Welcome, Dr. Mandell here with you. A great technique I want to share with you for those suffering with chronic lower back pain. This can be done anywhere, but preferably on a mattress, something that's semi-soft. The person who's going to be suffering with the pain is going to be lying on their stomach. The other person is going to be sitting on their buttocks and opening up one very important joint. Let me show you where. So the person will be lying face down on their stomach. Our focus is right here, the lumbosacral joint, the fifth lumbar vertebrae, and the sacrum. I'm going to sit on the person's sacrum, which I'll show you in just a second. And as I sit, I'm going to be exerting pressure downwards as we can open up the disc space in the lower back. Not only are we going to open it up, you'll feel stretching all around the ligaments. I will go over a few very important points that you should understand. Let's get right to it. Okay, I'll demonstrate on my daughter. She loves this particular technique done on her. This seems to really help her lower back, particularly the fact she spends so much time driving back and forth to school. I'm lying the spine. I'm going to lay the spine directly on her. This is how she's lying down right now. Over the sacrum, right here. Okay, this is the area we're going to distract. So what we're going to do, if you know the anatomy, which you should feel the lower part of the spine, and when you sit down, you want to sit on top of the base of the sacrum. Just to show you and demonstrate it, here is the top of the base of the sacrum, up on top, the area that does not feel like little vertebrae because it's one fused area. So what we're going to do is that I'm going to sit on her sacral area like this and put my feet out in front like this. Now when I sit on there, if I'm too heavy or too big, obviously if she says ow, then you're going to have to use your arms to resist away, or the technique may not be good for you. So all I'm going to do here is when I feel like I'm on the bottom base of her sacrum, I'm just going to use my feet like this and push back. Okay, that's it. I'm pushing back as I'm opening up the sacrum. What are you feeling? What are you feeling there?
It opens here.
Okay, you're feeling it stretch open. Okay, now if they say it's not working, it means that you're not sitting on the right area. But as I push back, you feel stretching. That whole sacral area starts to go downwards, distracting, opening up the disc between the fifth lumbar vertebrae and the sacrum. I could hold it there 30 seconds for some people, 45 seconds or a minute. She likes it a little longer because she's been having it done in the past. But at first, you may want to do short durations. Relax and push back again. You feel it stretch right there? Good. And that's all you're going to do. This technique is very effective. When you sit on the sacrum, you may not want to apply heavy pressure if you weigh a lot. You may want to use your hands to withstand some of that pressure. Although make sure you communicate very well with the person that you're actually trying to help. But most important, as you apply this traction, you can hold it for 30, 45 seconds, maybe up to a minute, and then you can relax and go back and do it again. And you can do that several times, maybe 3, 4, 5 times. This can be done once, twice daily, but if there is radiation of pain into the leg or the pain does get worse, I recommend you don't do this technique at all. I hope you find this technique very effective for you. Please leave your comments below. Check me out, Motivational Doc, on Facebook. Make sure you share this video and please subscribe so you can continue to get the cutting edge information to help you and your family. Make it a great day. I'm Dr. Alan Mandell.